Delighted to welcome the Vaccine Deployment Minister, Nadhim Zahawi, to the show right now. Good morning to you.
Good morning, Julie.
Good morning. Lots to talk about, lots of questions, Nadhim. Let's start with the Prime Minister's announcement later today, a press conference. Before that, we will have a statement in the House of Commons from your boss, the Health Secretary Sajid Javid, announcing the COVID winter plan. What do we know about it so far?
Yeah, no, absolutely. The Secretary of State will be laying out the plans for a fit-for-purpose COVID variant surveillance system, for obviously a really robust and fit-for-purpose test and trace system. And the central part of this is a really big, ambitious flu vaccination program and a COVID boost vaccination program. The JCVI actually gave us their interim guidance on boosting back on the 30th of June of this year, which allowed us to really plan and make sure that we get the system, the local systems, primary care, pharmacy, vaccination sites across the board primed and ready for this booster campaign, because actually boosting and protecting the most vulnerable is the way we transition this virus from pandemic to endemic over the winter months, and hopefully in future years have an annual vaccination program as we do with flu. Winter gives the virus an inbuilt advantage, as it does with flu, which is why we're being really ambitious on the flu vaccination program as well.
Okay, yeah, I mean, as you make the point, a booster program for the most vulnerable makes an awful lot of sense. This is very much an age-related disease. So why are we going to vaccinate 12 to 15-year-olds, as agreed by the chief medical officers yesterday, in the face of the JCVI, the Joint Committee on Vaccination and Immunisations, decision that it was not necessary?
Well, it's a really important and good question. The JCVI have really done brilliant work throughout the vaccine deployment. They came under pressure in the early days. Do you remember not to go down the sort of the cohorts 1 to 9, which is age-related, or if you are more vulnerable than others, whether you're immunocompromised or have clinically extremely vulnerable conditions that make you more vulnerable, and they were proven to be right on that issue. So the JCVI looked at the data from the US and Israel and other countries where they've been vaccinating at scale healthy 12 to 15-year-olds. Of course, they did recommend that we vaccinate the most vulnerable 12 to 15-year-olds to COVID, which we've been doing. But on healthy 12 to 15-year-olds, they said there is marginally more advantage to be vaccinated than not to be vaccinated, but not enough to recommend a universal offer. But they recommended that the chief medical officers look at sort of beyond their own clinical competence to look at other impact on 12 to 15-year-olds, not on the wider societal impact, on 12 to 15-year-olds, mental health, disruption to education. The CMOs did that with the Royal College of Pediatrics, with the Royal College of GPs, with the JCVI in the room, and yesterday recommended that we make a universal offer to 12 to 15-year-olds of a single dose, single jab of the Pfizer-BioNTech vaccine.
Why is this the first time that the government, when seeking medical advice and making decisions about people's lives and the vaccine, why is this the first time that the government has decided to look at the wider implications of any policy? Why have you not looked at the cost-benefit analysis on wider grounds previously, when it came to, for instance, closing schools down?
Well, first of all, I just want to respectfully correct you. It's not the wider society or the cost-benefit analysis. It's
on this, I know it's the implications for education and mental health. You did want to look at wider society.
Julia, you can't just sweep over that. It is the mental health of 12 to 15-year-olds, education disruption to 12 to 15-year-olds that the chief medical officer looked at and unanimously recommended. By the way, it was the JCVI who said to us that on balance, it is probably marginally more advantageous to be vaccinated, not to be vaccinated. And you should seek the advice of the CMOs on the wider impact on those children, on the 12 to 15-year-olds, which is what we did. So
can you address my question, sir? Why is it that this is the first time you've looked at the wider impact, even just on 12 to 15-year-olds, and the impact of their mental health, impact on their loss of education? Why was that not looked at when your government closed down schools for 44% of lesson time in the last year?
I thought I have addressed your question, because the JCVI recommended that we look at that by asking the chief medical officers.
And it never occurred to the government to look at the wider implications before?
Julia, I allowed you to ask a question. Just allow me to finish the answer, right? And then we can have a really good discussion here, right? You mentioned the non-pharmaceutical interventions. That was the only tool we had available to us, Julia, to try and bring this virus infection rates and hospitalizations and death, which were running at 50,000 a day infections and over 1,000 a day in January, deaths from this virus. That was the only thing available to us until we got the vaccines, which we began to really motor and scale in January of this year. And that's been the difference, which is why my big focus now is the booster campaign, both in terms of COVID boost and the flu vaccination program. We haven't had much flu, for example, circulating in anywhere in the world. And I worry about a bad flu season could kill 20, 25,000 people. So which is why we're being really ambitious on flu, as well as the COVID booster, which the Prime Minister and the Secretary of State will say more on later today.
Right. I would dispute the idea that lockdown was the only tool available. Other countries didn't lock down, and it wasn't the only tool available. I want to come back to this issue, though. Children's education was impacted in the last year and a half. Their mental health massively impacted. We know also children, along with adults, would have missed out on being taken to hospital, going to see their GP, getting early treatment for things like cancer and other issues. And yet those issues were not looked at when the decision was made to close schools. What I don't understand is, why is that suddenly something the government is looking at when it wasn't looking at those wider implications for children when those other decisions were made?
Well, again, on your point around the backlog, and of course, we think there's about 8 million people who haven't actually come forward for the operations. We've made £36 billion available to deal with that, 5.4 billion in the next 6 months, which I announced last week. When we entered this pandemic, we didn't have a vaccine available to us. We had to make decisions that were really difficult, including, of course, basically the social distancing, the dreaded NPIs, non-pharmaceutical interventions that you refer to, lockdown, and nobody does these things lightly. The JCVI, when they looked at 12 to 13-year-olds, actually then recommended that we should get the chief medical officers to look at the impact on mental health.
We're just repeating ourselves. For the benefit of my listeners, why don't we move on? Because I don't think we're getting anywhere there. My point is that the decision to close schools is a political decision. It didn't happen in every country, and therefore it's not necessarily impacted by children having this vaccine. I want to know also. We're told that parental consent will be required. However, a child can override parental refusal if they are regarded as someone who can give informed consent. How can a 12-year-old give informed consent for a vaccine when a 12-year-old can't give informed consent even to have their ears pierced by alcohol or have consent to sex? Why are they able to give informed consent for medical treatment?
So this is really important, just for your listeners to understand. This is the process that's been with us since the 80s. So the NHS, the school age immunization service, is really well equipped and well versed in dealing with this. For vaccination programs, have done it year in, year out. So we're not inventing a new system for the COVID offer that we're making to 12 to 13-year-olds. The process will be that the school age immunization service will deliver the information to parents. There will be a consent form sent in the usual way from schools. Some schools do it in hard copy for parents to sign, others do it electronically for them to approve. So parental consent is required on the very, very rare occasions where there is a difference of opinion between the parent who refuses their child to have the vaccine and the child wanting the vaccine. The first step is the clinician will bring the parent and the child together to try and reach consensus by discussion, sharing information. If that can't happen and the child still wants to be vaccinated, the clinician has to decide if the child is competent. If that child is deemed to be competent to make that decision intelligently and, of course, with the information available to them, then the child will be able to be vaccinated. That's a very rare thing to happen. Parental consent will be sought, and in the usual way that the school-age vaccination system does over many years. The NHS is really confident in this. They know what they're doing. They've done it for many years, and they'll continue to do so. So there's no new system for COVID.
Okay. You've been the minister overseeing the vaccine deployment. It's in the name of your job title. And it's been an extraordinarily successful vaccine deployment, not only getting the jabs into as many arms as possible, those who are vulnerable, who do need it, but also doing it speedily, much more speedily in the early months of this year than many other countries. And we've seen a lot of deaths and hospitalisations that didn't happen as a result of that. Why then does the government feel the need to keep vaccine passports, mask mandates, and even lockdowns as in their armoury for this winter? Surely rolling out the vaccine as you've done and preparing the NHS to increase their capacity should be the modus operandi for dealing with the COVID pandemic this winter, rather than ever shutting down any aspect of people's liberties again.
So, one, thank you for the compliment. 89% of over 16-year-olds have now had at least one jab. 80+% have had 2 doses of the vaccine. So it has been successful. And I think it's been successful because we've always shared as much information as we can. We've got one of the best regulators in the world, and of course advisors as well. The core element of our ability to transition this virus from pandemic to endemic and deal with it as we deal with flu every season going forward is the booster campaign, and of course the flu vaccination program, is having a really fit for purpose variant surveillance system, is having a really robust and fit for purpose test and trace system, which is why the uptake amongst 16, 17-year-olds, now over 50%, have taken up the offer of the vaccine, has allowed us to basically say, look, we don't need to introduce vaccine certification by the end of this month for nightclubs, for example.
You never needed to do that, though, did you?
No, I disagree with you. But anyway, we'll put that aside. It's important to keep these things in reserve. They are absolutely a last resort. Nobody wants to go back to the dreaded NPIs, the non-pharmaceutical interventions, the lockdowns. The last piece of I hope the last piece of this jigsaw is the booster program, which will protect the most vulnerable against COVID this winter. And then we can transition this. But it's only right that we plan for every contingency. And that's only the responsible thing that any government should
do. Does that include boosting NHS capacity? The NHS has a winter crisis every single year for pretty much the last 20 years. Have we boosted NHS capacity so that if there is a rise in cases and hospitalisations, as is very likely in the winter, and with flu as a concern, as you mentioned as well, that we've got the capacity, rather than us having to protect the NHS while we're not building up the capacity of the NHS to protect us?
We've done both. So the NHS having that 36 billion to be able to deal with the backlog, we'll be able to do 9 million more scans and operations on that. But also in the short term, I announced 5.4 billion for the next 6 months, about just under 500 million ring fence to make sure we get the capacity and the beds available so the NHS can deal with both obviously flu and COVID cases. I am concerned, which is why we're having such an ambitious flu and COVID vaccination program delivered by the NHS, by primary care, by pharmacy, and by the infrastructure that we've built for COVID. And I'm confident that we'll be able to do that, which is why we've made the funds available to do precisely what you asked.
Just finally, Nadhim Zahawi, I bumped into you at a Westminster reception a few weeks ago, and I offered you a bet. I said I thought we would bet for charity, a rather larger sum than I think I would have done if I had been completely sober, that we would be in a version of lockdown, whether you called it lockdown or not, but we would have a version of lockdown before the 31st of December. You hesitated and then bet me that we wouldn't. Are you still sure about that bet?
Well, look, I'm incredibly confident in my infrastructure, that the NHS have had the ability to deliver phase 1, phase 2, and now phase 3 of the vaccination program. I think the way we transition this virus is the winter months, look, have an inbuilt advantage for the virus, because for flu and for COVID in the winter months, but the booster campaign will have a downward pressure on the infection rates and therefore help us transition. I'm confident we can do that, but of course we make plans for every contingency.
Nadeem, sorry. I know you have to go, and I have to go to the news as well. Was that a yes or a no? Are you confident you're going to win that bet?
I am cautiously optimistic and hopeful that with what we're doing on boosting, on the surveillance system, on the test and trace, we'll be able to transition this without having to resort to the non-pharmaceutical interventions. Remember, they were the only things available to us. I know you disagree.
Can I just ask again, yes or no? Are you confident that you're going to win that bet, not me? Are we going to lock down before the end of the year?
I'm cautiously optimistic, and when we get there, I will come and collect the bet if I have won.
I can't tell you how delighted I'll be to write that check. Nadhim Zahawi, Vaccine Deployment Minister, really appreciate you joining us.